Patient-reported outcomes are expressions of patient health status that come from the perspective of the patient versus being measured by the provider or clinician. And what it allows us to capture is the patient's experience with illness or with treatment, ranging from things as general as overall quality of life to things as specific to the function of a particular part of the body after an intervention. And the nice thing about patient-reported outcomes in clinical practice is that it frequently can be used to complement a typical review of systems in terms of which parts of the body are giving you problems. This one also looks, patient-reported outcomes often look at what parts of your life are giving you problems, not just the state of your body or your health in the moment at which we are being queried. And what I'm hoping to talk about at San Antonio is the way in which patient-reported outcomes can be used in clinical practice, in research, and also to better understand the challenges as well as facilitators of care amongst particular cohorts of patients, that is extrapolating their individual responses to patient-reported outcome measures to understanding a group of people, and in particular, identifying ways in which a particular group might be vulnerable or at risk for disparities in care.